So, what's like a common pitfall you would see with folks? I mean, obviously, it's hard to understand if you're trying to choose your own plan, which is why I would go to a professional like you. But what are things if they did choose their own plan and maybe chose inappropriately based off of the coverage they needed? Like, what are some of the things that you would see?
Well, mainly the pitfalls are that, they choose a plan on their own and then all of a sudden they say, "Well, gosh, my doctor doesn't accept that plan." And now I've got to either pay out of pocket to see that doctor or I've got to, choose a new doctor. And that's the main pitfall. And of course, if your medications aren't covered sufficiently and, the medication's not in the formulary, then, it's not subject to the $2,100 max out of pocket. So that's a really important thing to note as well. Make sure the drugs are in the formulary. If they're not, then you could end up paying who knows how much for those medications?
Yeah, medications aren't cheap, that's for sure.
No.
I once got, total side note, but it just popped in my head. I got eye drops for allergies, so they weren't over the counter, it was prescription, and, I had to pay when I got it, like, 100 it was a little over $100 for a teeny tiny vial of eye drops, and I asked the pharmacist when she told me what the total was, I was like, "Didn't my insurance cover it?" And she's like, "Oh, yeah, that's after your insurance." Like, holy cow, how much are these eye drops? Like, it's crazy what they're charging for prescriptions.
I've seen that. I helped another couple a few years ago. They were actually in their 80s at that time, late 80s. I helped them out. And she was on a very expensive eye drop, $500 a month. They didn't know they had to have Part D. Again, they were in their late 80s. Very savvy though. The man, he was very capable of like checking his email and checking PDFs and sending me PDFs. And it was really cool. But they didn't know they had to have a drug plan. So they never needed one. They were healthy, but she was paying $500 a month for her eye drops, and I was able to help get them in a plan that covered it at $60 a month, so,
Yeah, that's a huge cost savings.
yeah, definitely.
So, all right. So, I think we understand the common pitfalls, why you'd want to work with a professional to help guide you through the necessities of it. So, when somebody comes to you for the first time to enroll, like what are the questions that they would typically have?
When they first come, I mean, they always wanna know, you know, typically when they first come to me, I guess that's hard to say because I do a lot of the talking initially, and then as I'm doing my presentation, questions come up. A lot of the times people wanna know, will I get penalized if I don't take Part B right away if I'm still working? That's a common question people will wonder about, and, the short answer, I guess, is that if you're delaying your Part B, if you're gonna work past 65, you can delay taking, really all parts of Medicare. You don't have to take either A or B. Um, but, uh, if you have active employment, if you have creditable coverage through active employment or through a spouse's active employment, then you can actually delay taking Part B until you're ready to retire. But oftentimes I advise people, if you're on the fence about when you might wanna retire, it's a good idea to maybe sometimes take the healthcare out of that equation. So that way you can retire when you want and don't have to scramble to get healthcare. So there's all sorts of factors and we're happy to, help people with, any of those questions. Some people don't know how to sign up for Medicare. I help them through that. And it's not just you come here and I talk at you and get you a plan. I really want to work with people and help them in any way that I can when it comes to Medicare. So,
That's what business is all about, having the relationships and helping people when they need it.